I know firsthand that you are a caring individual. You care for our youth. My sons participated in the All-American Boy and Girl Contest, which is why I'm about to tell you how we will have no choice, appealing to your sense of caring. So please listen. The healthcare crisis that we're in right now all started way back in the 80s when DRGs were instituted by the federal government. I worked at that time for American Hospital Association, and I told my colleagues this was going to be the demise of healthcare. I was laughed at. They said it has nothing to do with private insurance companies, it's only for the Medicare program. I then responded by saying, once the private insurance companies realize that the government is getting away with reduced payments, they will jump on board as well. They thought I was crazy until HMOs came aboard. When HMOs first started, they were a good thing until they too decided how they were going to cut costs to make it more affordable for them and increase their salaries. That's why we're in the problems that we are right now. Now, the choice comes into play. I am a Chicago public school teacher. My husband is a Chicago firefighter. Every municipality worker will not have that choice. I'm pretty sure that Mayor Daley will use the cheaper option for the rest of us. Our choices have been limited down to 2 from the time that we first became public employees. It's going to continue when the government undercuts the private insurance companies. Yes, there will be some private insurance companies who will get on board for survival and come down and perhaps work with those in Washington with whatever perks are given to them. But the honest ones who are trying to service the community will go belly up. There will be more Jennifers, and my heart goes out to you. I am a mother of 3, one of which is now in a pre-med program, graduated from St. Ignatius High School. He and his other classmates that were in the pre-med program are now searching for a different option. It costs $200,000 to go to med school. We will lose good, smart doctors. What will be left will be the HMO doctors that many of us have left. I'm going to share a personal story and then I will stop. It's on the opposite end of the Jennifer story, and again, my heart goes out to you. Nobody in this country should die unnecessarily. My father-in-law did. He did have insurance. He was in an HMO. He was a diabetic who had a series of viruses that caused him a setback. He was 73 years old. For a year, they battled it until the room and board charges of his insurance ran out. My mother-in-law, on a fixed retirement income, paid for his room and board services. However, the HMO had to pay for the medical services that were being provided. He was too old and got too sick, and what they did is they convinced my fatigued mother-in-law, who had been at that hospital relentlessly for a year, to withdraw the dialysis machine. If you're 10 years old, you withdraw a dialysis machine and you die. That is exactly how he died. He did not die because of his medical situation. He died because he was too costly to keep that medical equipment to keep him alive. And if he had not been in the hospital for the series of viral infections and the poor health care that he received, which caused him to have a life-altering or a health-altering situation, diabetics must have open wounds attended to immediately. He was neglected, and that is what they were battling for a year due to the neglect of the staff that didn't take care of it. And then they convinced my mother-in-law, because he was too old and too sick, to continue to pay the costs for it. And that's what's going to happen when we have a national health care system. National health care will be one big HMO. How many of you have dealt with HMOs in this meeting? If you've dealt with an HMO, you know that you have to wait months to even see a doctor, and then the doctor's hands are tied on what services they can provide you because they are dictated by the cost formulary that the HMOs have given the doctor in your health insurance plan. Congressman Lipinski, as a Chicago public school teacher who is committed and passionate to our children, I don't want to be put in a situation where I'm told that I have to be put in one big government HMO. If Mayor Daley can spend money to try to get the Olympics here, then perhaps we can start spending that money to fix our system instead of completely throwing it out and forcing it to be in a system we don't want to be. We want to live, Congressman. We don't want to die.
the gentleman right here.